5 things that I would tell my patients to do. So number 1 would be get moving. I'm also a certified personal trainer. And I play a lot of sports. So one thing that we've learned over the years is that exercise is king. Whether it's cardio or weightlifting, which I recommend doing both. And I think that makes you very functional. It makes you live longer, longevity, VO2 max, heart rate variability, increasing your strength so you can do things when you are older and when you are younger, being able to get out there and do stuff with yourself and your kids and your grandkids and your siblings, etc. Lots of potential there. Second thing is, you got to clean up your diet. The more whole foods you're trying to eat, the more Mediterranean style types of foods you eat is what we recommend. Mediterranean diet is the most recommended diet. This is like fruits, vegetables, beans, nuts, legumes, lean meats, lots of fish, poultry, minimal to no alcohol. If you're going to use oils, let it be vegetable oils, olive oils, things like that. That is the kind of diet that has been proven over time with multiple studies and over 100 years. It's the undefeated diet. Lots of diets come and go, but the one diet that has been shown time and time again to reduce cardiovascular risk over a long enough time horizon has been the Mediterranean diet. So that is what we recommend to our patients. Number 3 would be go to your doctors and get checked out and evaluated long before you actually need us. So one thing that I love as a preventative cardiologist would be patients that come to us long before they actually need us. That is super important. Imagine if we get to see patients when they're 20 and 30 years old, because heart disease is a disease that starts in your teenage years and we finally get to see you decades later. That's not fair. We have a lot of people in their 20s, 30s, 40s, and 50s. They're like, you know what, doc, I wish I would have seen you 20 years ago or 30 years ago in a lot of cases. And that's unfortunate. There's a lot we can do starting out at a very young age where we could prevent a lot of this disease, but we just, people never saw doctors, they never thought about it, all those things. So that's another thing we definitely want to prevent. If we could prevent cardiology, if we could prevent heart disease, that would be the best way to do it for patients and for their families. Number 4 would be don't delay. If you are having any kind of cardiac symptoms like chest pain, or you're out of breath, or you're having stroke-like symptoms, numbness, tingling, just something is a little bit off, don't delay. Go see your doctor right away. It's super important. Or go to the emergency room. If it's bad enough, obviously some of these things you have to go to the emergency room, but do not delay. Get the proper care so that it can act acutely and treat you if needed and get that all taken care of and stabilized. Number 5 would be have fun in life. You got to try to reduce stress, get better sleep, enjoy your family and friends, go out and travel the world, go to places you've never been before, try foods you've never tried before. That reduces stress, and we know that reducing stress reduces heart disease. Multiple studies have now shown this, where if we reduce stress, get better sleep, have good job satisfaction, happy with our relationships, making good money, all that kind of stuff is super important because it reduces stressors, which can lead to heart disease. So that's all I got for you.